Hi everyone. Today we are going to see about oxytocin. In the introduction, oxytocins are the drugs of varying chemical nature that have the power to stimulate the contraction of uterine muscles. So it's the main use of oxytocin is to contract the uterine muscles. It is also called as a uterotonic agents. So it is used to induce contraction and also increase the tonicity of the uterus. It stimulates the uterine muscles in the uterus to contract and also for relaxation. It is used both to induce the labor as well as to reduce the postpartum hemorrhage. Next, it is also called as a love hormone since it is associated with women, childbirth and lactation. So it is known as a love hormone so that it creates a bonding relationship between the mother and the child after the delivery. This is also known as an anti-stress hormone. So why we are calling it as anti-stress hormone in the sense it helps in the reduction of blood pressure and also it helps in reducing the cortisol level also. So that is the introduction about the oxytocin. Next we can see the classification of oxytocin. So among the large number of drugs belong to this group, following are the important and extensively used in clinical practice. So the classification of this drug is divided into three. The first one is oxytocin, the second one is the ergot derivatives, and the third one is the prostaglandins. So I repeat, it is classified into three. In that the first one is oxytocin, second is the ergot derivatives, and third one is the prostaglandins. So in this we are going to see in detail about the oxytocin. So oxytocin is synthesized in the supraoptic and paraventricular nuclei of the hypothalamus to the posterior pituitary where it is stored and released. So you can see the picture. Okay, so the oxytocin is stimulated by the supraoptic and paraventricular nuclei of the hypothalamus. So from there it moves to the posterior pituitary where it is stored and released. So when it is released in the sense during the time of childbirth, lactation, puerperium. In case of puerperium, it helps in the contraction of the uterus. And also in case of stress, as we have seen, it is a stress releasing hormone. It is stimulated during the time of stress also. So this is about the secretion of oxytocin. So oxytocin secretion occurs by sensory stimulation from cervix, vagina, and also during suckling of the breast, where the baby when sucking the breast for breastfeeding, during that time also the oxytocin will secrete. So oxytocin has a half-life of 3 to 4 minutes and duration of its action is approximately 20 minutes. So next we can see the mode of action of oxytocin. So here the oxytocin receptor concentration increases the myometrial contraction and increases maximum during the time of labor. So this oxytocin will be increasing during the time of labor. Its secretion will be increased where the oxytocin acts through the receptor and calcium channels. It initiates the myometrial contractions. So it stimulates the amniotic and residual prostaglandin production. The intracellular calcium is mobilized from the sacroplasmic reticulum to activate the contractile protein. So the uterine contractions are physiological in nature where it causes the fundal contraction with relaxation of the cervix. So this is about the mode of action. So next we can see some of the preparations of oxytocin. So what are the other names that is existing in the field? So there are different preparation available. So first one is syntocinon, next pitocin, synthometrin, oxytocin nasal solution, D-amino-oxytocin. So these are some of the preparation which is available. So we can see it one by one. So first is the synthosin. So synthosin, it consists of 5 units per ml in ampules of 1 ml. So the 1 ml ampule contains 5 units of oxytocin. It can be used as a controlled infusion through IV by diluting it with finger lactate or normal saline solution. Next we can see about pitocin. So it is available as a 0.5 ml ampule form where it contains 10 units per ml. So it is available in 0.5 ml of ampule where it includes 10 units per ml. Next is the synthometrin. So the synthometrin is the combination of synthosin and ergometrin, where synthosin is 5 units and ergometrin is 0.5 mg. So this is a combination of two things. The next is oxytocin nasal solution. So it is available in 40 international units per ml. It is not of much in use. So the next one is D-amino-oxytocin. So it is not inactivated by oxytokinase enzymes and is 50 to 100% more effective than oxytocin. It is used as a buccal oral tablets containing 50 international units. Though it is very effective than oxytocin, it is not of much in use. So these are some of the preparations available in the market. So I will name it again: synthocinone, pitocin, synthometrin, oxytocin nasal solution, D-amino-oxytocin. So these are the preparations. So next we can see the indications of oxytocin. So where oxytocin is indicated. So the indications is divided into the pregnancy, labor and puerperium. So in case of pregnancy, where it is used in the sense, it is used to induce labor and abortion. So for inducing labor, for stimulating the uterine contraction, we will be using oxytocin, and also in case of abortion, to expel the product of conceptus, we will be administering oxytocin. Next, to facilitate cervical ripening. So ripening helps in cervical dilatation also. So for that we will be using oxytocin. Next, in expulsion of hyalidiniform mole. Then for oxytocin challenge test, where it is a test to assess the fetal well-being. So for that we will be administering oxytocin. Next is to stop bleeding. In case of puerperium, or in case if the mother is having any severe bleeding, in those cases we will be administering the oxytocin. Next is in case of labor, we will be administering the oxytocin, where in the sense for induction, as we have seen already, for induction of labor we will be administering the oxytocin, and also in augmentation of labor. Then in uterine inertia. So what is uterine inertia in the sense? Uterus fails to contract with normal strength, duration and interval. So it causes difficulty in expelling the fetus. So this is uterine inertia. So in those cases we will be administering this oxytocin to easen the delivery of the baby. Next is active management of third stage, where in case of third stage to control the bleeding, and also it helps in the contraction of uterus. So for that we will be administering this oxytocin. Next is to prevent and treat postpartum hemorrhage. So as you all know what a postpartum hemorrhage is, there will be excessive bleeding. So in order to control that, we will be administering oxytocin. Next is a treatment of atonic PPH. So what is atonic PPH? In the sense, atonicity is loss of muscle tone or strength to contract. So atonic PPH in the sense where there is excessive bleeding, in those cases uterus is not well contracted after delivery, and the uterus will be soft, distended and lacking of muscle tone will be present. So in order to treat this, we will be giving oxytocin. Next, in case of puerperium, it helps to initiate milk letdown in breast engorgement. So in case of breast engorgement, where the breast tissues will be swollen and the mother cannot be able to let out the milk. So it will be stagnated. So in order to expel it, we will be administering this oxytocin. Next is promotion of uterine involution. So after the delivery, that is in the time of puerperium, the uterus has to involute. That is the size and shape will be reduced to the pre-pregnant state. So in order to achieve that, the involution should occur. So if there is any problem with the uterus, we will be administering this oxytocin so that the uterine will be involuted back to the normal condition. So these are some of the indications. So we have seen the indications during the time of pregnancy, labor and puerperium, why we are administering this oxytocin. So next is the use of oxytocin in diagnostic indications. So as a diagnostic purpose also, we are administering this oxytocin. So in case of oxytocin challenge test or contraction stress test, we will be using this oxytocin. So what is the meaning of this test? In the sense, it is a test to assess the fetal well-being in case of antenatal period. Okay, so to check whether the fetus is in good condition or not, we will be doing this oxytocin challenge test. So it is based on the response of fetal heart rate recorded on a cardiotocograph to oxytocin induced contraction. So the main aim of this test to induce contraction and monitor the fetus by checking the fetal heart rate. So this is the main aim of doing this diagnostic. So next we can see what are all the contraindications of oxytocin. So there are some of the contraindications. It is divided into contraindications in pregnancy and contraindications in labor. So in case of pregnancy, let's see what are the contraindications. First is the grand multipara. So grand multipara in the sense women who have given birth to 2 or 3 babies. Okay, so that is grand multipara. So in those conditions where the uterus and the muscles will be weak in nature. Okay, so in those conditions, if you are administering oxygen, in the sense the uterus will be acting fast and there will be rapid contractions. It will be there, so it leads to rupture of the uterus also. So in grand multipara, it is contraindicated to administer the oxytocin. Next is contracted pelvis or CPD. CPD is cephalopelvic disproportion. So contracted pelvis in the sense where the diameter of the pelvis will be reduced. Okay, so it interferes in the normal labor. So during that time we should not administer oxytocin. And also in cephalopelvic disproportion, where the baby head or body is too large to fit into the mother's pelvis. So in those cases also we should not administer oxytocin. Next is history of LSCS. So in case of LSCS, there will be previous scar for the mother. So if we administer oxygen in the sense, when the uterus contract and relax, it may leads to rupture of the scar also. So we should not administer oxytocin in case of cesarean section. Next is malpresentation. So malpresentation is the abnormal positioning of fetus at the time of delivery. So when the baby is in abnormal position, we cannot expect normal delivery. Even if we administer oxytocin also, it cannot help to deliver the baby because the baby is not in the normal position. So these are some of the contraindications in pregnancy. Next, during labor. So labor includes all the contraindications what we have seen in the pregnancy, that is grand multipara, contracted pelvis, CPD, LSCS scar, malpresentation. Along with that, there are some other also, that is the obstructed labor. So in case of obstructed labor, where there is a failure of presenting part to pass through the pelvis. It may be due to any malpresentation, cervical dystocia, CPD, or any other thing. So during those times it leads to obstructed labor. So in those conditions the oxytocin should not be administered. So next is fetal distress. So fetal distress in the sense fetus has not been receiving enough oxygen. Okay, during labor the baby is not able to get enough oxygen, so there will be decrease in fetal heart rate. So that causes some danger for the baby. So in those cases oxytocin should not be administered. Next is incoordinate uterine action. So incoordinate uterine action in the sense sometimes there will be a good uterine contraction will be there, but there will not be proper dilatation of the cervix. Okay, so that comes under incoordinate uterine action. And also there may be some dyspolarity of upper and lower uterine segment. So that is known as incoordinate uterine action. So in those cases also we should not administer oxytocin. So these are some of the contraindication which we have seen during the time of labor as well as in the time of pregnancy. Next is the side effects. So what are the side effects of oxytocin? So in the side effects there is maternal risk. So in case of maternal risk, there is the first one is uterine overactivity or hyperstimulation. So what is uterine overactivity or hyperstimulation in the sense where there is increased uterine contraction. Okay, so increased uterine contraction in the sense where there is 5 or more uterine contraction will be occurring in 10 minutes or in the sense single contractions it will be for more than 2 minutes. So that we will be calling it as a overactivity or hyperstimulation of the uterus. So that comes under the side effect. So if we are not administering the oxytocin in proper dosage and if we are not monitoring the mother, it may lead to this hyperstimulation or overactivity of the uterus. The next is uterine rupture. So if the uterus is responding too much in the sense, if there is hyperstimulation, it will lead to rupture of the uterus also. Next is water intoxication. That is if we administer the excessive dose or if we administer the oxytocin in a prolonged period of time. So in those cases it leads to water intoxication. Next is hypotension, where the blood pressure will be reduced, where the systolic blood pressure will be less than 90 millimeter of mercury and the diastolic blood pressure will be less than 60 millimeter of mercury. So these are some of the side effects of oxytocin in case of maternal condition. So next let's see what are the side effects that occurs for the fetus. So first is fetal distress. Next is fetal hypoxia. So where fetal distress or hypoxia occurs when the fetus is not getting the enough oxygen. Okay, in those cases this fetal distress or fetal hypoxia will occur. And finally, if there is no sufficient oxygen for the baby, it may lead to death of the fetus also. So these are some of the side effects that occurs in case of maternal and fetus. So next we can see what are the methods of administration of oxytocin, how we can administer oxytocin. So first is through controlled intravenous infusion. We can administer the oxygen, that is through IV infusion. And the second one is through intramuscular injection. So we can administer it through intravenous or intramuscular injection. So in case of intravenous infusion, so we have to start at low dose rate. Okay, we have to start with a low dose rate of 1 to 4 milli-international units per minute and increase gradually to a maximum of 8 milli-international unit per minute. We have to start, we have to increase the rate of infusion gradually. Okay, So we have to first start as a low dose rate. We have to assess the mother, whether the mother is okay, she can able to tolerate it. If she is okay, in the sense, if and also the mother is getting enough contraction, we can increase the rate also. When the optional response of sustain 3 contractions in 10 minutes lasting for about 45 seconds is met, oxytocin will be maintained at that contraction. So when we are administering the intravenous infusion, if suppose the mother is getting 8 drops per minute in the sense, and the contraction is 3 contraction in 10 minutes, which is lasting for 45 seconds, we have to continue with the 8 drops itself. We should not increase or decrease the oxytocin. Okay, so with that itself the mother is getting enough contraction, so we have to maintain that rate. So this is how we will be administering in the intravenous infusion. In case of intramuscular injection, 5 to 10 minutes intramuscularly we can administer for the mother, that is after the childbirth. So this is about the method of administration. So we have seen about the oxytocin, how it is secreted, then the side effect, everything. So the final thing is the nurse's responsibility. So what are the nurse's responsibility in administering the oxytocin? So first we have to check the intensity, duration and frequency of uterine contraction. So before administering the oxytocin, we have to check these things. What is the intensity, duration and frequency of contraction? So after assessing these things, we have to start with the oxytocin drip. So after once we are starting the oxytocin, then after 15 minutes, every 15 minutes we have to again go on with the intensity, duration and frequency of contraction, whether the mother can tolerate, whether there is any hyperstimulation. To assess those things, we have to monitor the mother. Next is we have to monitor the blood pressure, pulse and respiration, and also the rate of flow of oxytocin drip. Then we have to maintain the labor progress chart. So you'll be knowing about the labor progress chart, that is partograph. So through that we can assess whether the mother is acting normally or any abnormality is occurring. To assess those things, we can use this partograph. So we can check the intensity, duration and frequency of the contractions also. So we have to maintain this labor progress chart. Then notify the physician if there is frequent contractions or any absence of contraction. So if there is any abnormality, in the sense whether the mother is responding too much or if she is not responding, we have to inform the physician regarding that. Then teach the patient and family to report for any increased blood loss. That is in case of during the puerperium period, tell the family members and also the patient whether there is any increased blood loss or the mother has any increased pain in the abdomen or uterus. So the family members are asked to report. Okay, so this is about the nurse's responsibility during oxytocin. I think everyone has understood. So we have seen about the oxytocin, its classification, then the mode of action, then what are the preparation used in that, then the indication, contraindication, side effect, then route of administration and also the nurse's responsibility. I hope everyone has understood my topic. Thank you everyone.